or make a move? What are my numbers looking like? So that's more of the performance realm. We want to make sure that we first prioritize input. Can I actually tolerate the amount of input and the rate at which the input is coming into the body to be able to have the tissues tolerate that potential force and reduce my susceptibility for injury? If I can have good input, I can likely then be able to exude the amount of output that I need for the subsequent takeoff or push off or whatever it may be for the sporting demands that I choose to be immersed in. And so when we look at this, force absorption is just deceleration, okay? We're also considering here those same movement options that I need available to have deceleration, thinking of the internal rotation or thinking of the dorsiflexion eversion at the foot and the ankle. And then we go to production after that, which is more of the performance aspect. From a contraction perspective, we start more with isometrics because that's something that's stationary, it's the brakes, and then we gradually get into eccentric, which is the absorptive, the absorption. So more of the emergency brakes, if you will. And then lastly, concentric, which is, hey, we're pushing on the throttle, we're going all out, we're producing force and getting ourselves off of the ground. Coming down from there, we look at things from a continuum of complexity and challenge of competency first. Competency is going to be, we're looking for someone to be proficient with movements, meaning low intensity, low to moderate volume. Do they feel comfortable and confident with it? And then once they demonstrate certain qualities, we move to more of the capacity. Can I do that repeatedly for a long period of time and still have relative decent mechanics and making sure that I still feel confident with it? I'm not breaking down due to fatigue, and we'll talk a little bit more about capacity for one of our principles coming up. And then lastly, specificity, making it a little bit more relative to their particular sport. So I can do as many box jumps and depth drops and bounds as I want, but how do I then apply that to my particular sport? How can I create scenarios that are a little bit more chaotic or unpredictable so that I can really understand, okay, I feel like I'm really ready to return, or hey, we need to kind of rein you back in a little bit because this is what we've noticed. So if we understand, again, all the variables that we can manipulate and try to decrease some of the noise, I think we can make better decisions about how to progress patients along this rehab to performance continuum. The last thing here is looking at the medicine ball formatting. So with this, a lot of medicine ball stuff that we see or that I've seen can be a little bit more ambiguous and a little superfluous, where people are just throwing medicine balls any which type of way. So here what we're understanding is what are the essentials, what are the variables to consider with medicine ball training. Same thing that we just looked at for plyometrics. Again, always ask yourself, what are the variables? What can I actually control and manipulate? And is it important? And so when we'll go into this with the lab here in a second, but we're looking at first just position. All position is think of it as like a developmental progress of going from the least demanding, least taxing position, so tall kneeling, eventually to a standing upright against gravity position. From there, we can go into pattern. So it's just the stance of the appendicular skeleton, meaning lower extremity. What stance or pattern am I demonstrating? Because that's going to make it a little bit more complex as well when I'm trying to demonstrate force output. Plane is pretty simple. Plane is going to be orientation relative to the wall. So if the wall is here and I attempt to throw the ball there, am I going to be in a linear sagittal position, or am I going to be in a more frontal position? And then we go into power. Vector of the throw. Vector is going to be, if I'm in this position forward, I want to throw in a sagittal oriented position. If I am standing laterally, when I throw, it's going to be more of a rotational power output. And then lastly, we look at performance. Performance is more of the degree of movement from the axial as well as the appendicular skeleton. This one is the one that's a little bit more complex. Typically, we'll start with dynamic, and eventually we need to get to locomotive. So static basically means, hey, I'm pretty stationary. There's not a lot of degrees of movement. There's not a lot of complexity with it. I might move more of my appendicular skeleton, but I'm not moving a lot of my axial skeleton with this. I'm not getting a lot of rotational demands. And then next I'll go to more dynamic, where I might get a little bit more excursion from the hip, the knee, and the ankle. So I'm actually loading into more of the absorptive to be able to have more propulsive output. And then lastly, the locomotive, where I'm actually moving my body in space to be able to throw the ball and produce more force. So we're synchronizing things together. And again, we're understanding that this is a continuum of thinking low intensity to high intensity, more simple to a little bit more complex, low degrees to high degrees of freedom. So what we're going to do now is break up into groups of three groups of around, I forget how many people are here, maybe eight to 10. Myself, Anthony, and Mike are going to have you all go through a linear, a lateral, and a transverse rotational breakout so that we can understand, okay, how do we coordinate the movement options, and then how do we start talking about expressing force, where we can go through more of the plyometric progressions as well as the medicine ball progressions. And keeping in the back of your mind this chart here of what we're really trying to demonstrate with each individual movement at each individual joint. Okay?
So let's get one group over here with Mike. How about these guys over here?